When it comes to cancer, if you were diagnosed, would you go to a carnivore diet given what you've seen? Or is there additional benefit from getting you talked about some plant compounds there too. So I'm just curious,
Yeah.
what way would you go given what you know right now?
I think for people who have food allergies and for people who are willing to adhere to it, simply eating meat, liver, fish, beef, things like that are uh, can be therapeutic. And I think a lot of the positive results happen because the carnivore diet's preserving muscle mass. It's also controlling appetite in a way that creates a caloric deficit. And by virtue of creating a caloric deficit, you are suppressing the hormone insulin. You have amazing glycemic regulation. There are some people who go on carnivore and their glucose goes up, but a calorie restricted carnivore diet is therapeutic from the context of a glucose ketone index. So for me, it all comes down to what does the science say? A glucose ketone index of 1 to 3 is therapeutic. So, however you achieve that, you could do a vegan diet. If you could achieve that with a vegan diet, it would be hard, but that would be therapeutic. I personally believe that titrating in certain plant-based compounds, especially if you're just cruising and wanting to do this for prevention, like coffee, cocoa, cinnamon, turmeric, garlic, ginger, with vegetables like broccoli. I have almost a half cup to a cup of wild blueberries every day. Um, mixed salads here and there. Sometimes I'll go a couple of weeks without having any salads, but I do try to keep broccoli as kind of a staple, not like a huge bowl, but more like a garnish on the side. And I think a little bit of fiber at the end of the day can be helpful. However, sometimes I run out of broccoli and I'll go weeks without having, and buying it. And it's like, man, maybe I feel a little bit better. So, so I'm not a vocal advocate of the carnivore diet, but for someone who's not a vocal advocate, I tend to follow it a lot. So, but I'm not one of those people that come out and like promotes the carnivore diet, but I do believe that it's a really valid option for a lot of people. I think there's a lot of benefits to it, but I am not also of the opinion that plants are trying to kill you. So I'm not in that crowd. Although oxalates, and various other plant-based compounds are problematic in people who are doing these plant-based only diets and vegan diets. There's no doubt about that. But largely speaking, I don't believe that plants are a problem, that fiber is a problem. The epidemiological data is highly skewed to the benefits of fiber. So how do you explain that?
It sounds like maybe unintentionally you've given the carnivore diet a try, when groceries run out or whatnot. But have you ever given it like a 30-day go where you've just had like meat and salt and water?
Not 30 days, but I've definitely done 2 weeks and I did blood work after that, and my LDL and ApoB went up. So then I started just adding a little bit of carbs back in, mostly in the form of wild blueberries, dark chocolate, and a little bit of salad and broccoli. But we're talking like pretty small amounts. And then we have avocado trees. We have mangoes, on our property now. So I tend to kind of add these things into the diet periodically. But I will say when I start to feel like inflammation coming on, or I start to feel unwell in some way that I can't really explain, and I feel some things my body, if I default back to a carnivore diet, just meat and salt and water, and I guess I'll have coffee. I don't know, coffee is not carnivore, I hear, but if I default to just more of a carnivore approach, I do feel better. I have to admit that, even though I'm not like an advocate for it, I do when I'm feeling unwell and my mind feels a little bit sharper, right? I feel like this morning, all I ate was I have grass-fed ground beef that I bought at Walmart of all places. I gave blood last week and I got $50 card for Walmart and I bought $50 of grass-fed ground beef because our local supplier. I ran out from that. And that's all I had this morning. I had 2/3 of a pound of grass-fed ground beef. And, I feel great, almost like I'm fasted. And if I was to have like a standard American breakfast, I would not feel good at all. So I grew up, eggs and oatmeal with an unsettled stomach throughout the morning, and just kind of never figured out in my youth that the oatmeal was kind of messing with my stomach. So
Talk more about the plant-based approach to cancer because I feel like when it comes to naturally taking on cancer, if you were to do a Google search, you'd have these two camps. And at the extreme, you'd have vegans and maybe juice cleansing, and then you'd have carnivore at the other end. And
yeah,
I feel like both may have fasting as part of that regimen. But what
yeah.
is research showing when it comes to the vegan diet and battling cancer?
The Hippocrates Institute, which is here in Florida, I visited them before, and they do have good success with patients, but they tend to lose a lot of muscle, and they have that calorie restriction, sunken face kind of look, right? And I think a plant-based vegan approach works. Not everybody, but it can profoundly reduce inflammation. It can reduce insulin. It can reduce glucose just because the food that you're eating is fairly hypopalatable. So you don't overconsume it, for one thing. You get, if you do your homework, you can get the nutrition that you need. But you're typically in a calorie deficit state. And as you follow this, and what that does is it improves dramatically many different cardiometabolic biomarkers and insulin associated with cancer growth. So you're just reducing the drivers for cancer. And it's debatable, but there are compounds in plants that have anti-carcinogenic effects, at least in petri dishes. But I am not fully convinced that this is translatable. I think the major benefit from these vegan and plant-based diets are simply due that they lower glucose, they lower insulin by virtue of creating a caloric deficit. That's my opinion until someone convinces me otherwise. There are, the most compelling data, I think, is from some of the work that was done by colleagues actually at Moffitt Cancer Institute. Dr. Nagi Kumar looked at things like green tea and other plant-based compounds, that are encapsulated through extracts. And these things can be incorporated into a normal diet. And they have, almost drug-like effects at reducing inflammation, at suppressing different pathways. So there's no doubt that there are components in plants that have anti-carcinogenic effects, but I'm not sure you would get them at, the high concentrations just by eating a vegan diet. But you can get extracts of various things like EGCG. So EGCG may actually work well with the metabolic approach to cancer because it tends to bind up and reduce glutamine in the blood. So some studies show that extracts of EGCG could lower glutamine by like 15 to 20%. So that could be favorable. So yeah, I would not. I think an ideal approach could be a plant-centric ketogenic diet. And many patients come to me and say, I do not want to eat animals. And sometimes you can talk them into a vegetarian approach where they just incorporate eggs and maybe a little bit of dairy. But I don't think there's anything in particular beneficial to a vegan approach. And of course, there's the Budwig protocol, and there's lots of different, websites and people that promote it. But I don't think there's anything in particular that would be, for me as a metabolic scientist, it really comes down to metabolic physiology and the glucose ketone index. That's not to say that you can't incorporate many of these plant-based compounds into a ketogenic diet, and then you get the best of both worlds, right? So do your research, and there are books written on this, and I don't, go into it. I have them, I've researched it, and I have various protocols that kind of I share with others on that. But I think everybody has different opinions, and I don't want to promote it too much because some of these plant-based compounds can interfere with standard of care therapies, including radiation or even immune-based therapies. So I don't feel like it's good to over promote them. I do think many of these things are great for a preventative approach.
So we've talked about keto, carnivore. We've went to the other end of the spectrum into the vegan diet.
Yep.
The other area I'm curious your thoughts is somebody straight up water fasting. And right away, as I say that, what pops into my head is when you're talking about cachexia and losing too much weight and losing muscle mass. And I do want to touch on the exercise piece and using that as an adjunct to metabolic therapy. But how do you feel about water fasting?
If someone's BMI is 25 or over and they engage in resistance training and they're not afraid to eat adequate protein, meaning 1.5 to like 1.8 grams per kilogram, then I'm for it. That's a lot of criteria there. But I am for water fasting, especially in the context of going in for chemotherapy. So, and Walter Longo has, done his fasting mimicking diet, but there's good research on fasting prior to chemo as a means to reduce side effects and then to augment the cancer killing effects of chemo. So that's beneficial. Also, from the metabolic approach, a comprehensive metabolic approach could incorporate hyperbaric oxygen therapy, which reverses tumor hypoxia. When you hyperoxygenate a tumor and reverse tumor hypoxia, the oxygen produces proportionally more superoxide anion and then the hydroxyl radical we talked about, mostly because of the free iron associated with the breakdown of various heme proteins that drives the Fenton reaction. So you have oxygen specific effect within the tumor where it creates a scenario where the tumor cells are selectively vulnerable to the oxygen killing effects. And some of the early observations that we made in cancer cells is that if I had primary dissociated hippocampal neurons or primary dissociated cortex neurons and I hit them with oxygen, a certain level of oxygen, they were more or less okay. I could see that they're under stress because I measure intracellular calcium and I measure oxygen free radicals. But if I do the same protocol to glioblastoma cells or various cancer cell lines that we have, I noticed that that level of oxygen would kill them. And when I ended up measuring using dihydroethidium and then mitosox, a mitochondrial reactive oxygen species dye, I saw that the mitochondria are producing this big burst of oxygen free radicals. So that gave us the idea to look at hyperbaric oxygen, and surprisingly, giving hyperbaric oxygen to animals that were not on a ketogenic diet didn't really do much. There was trends for decreasing tumor growth, but when we coupled the ketogenic diet with hyperbaric oxygen, then we saw a nice additive, borderline synergistic effect to that. So that maybe I steered us a little bit off path, but I thought it was important to kind of mention the hyperbaric oxygen because I know a lot of people are doing it. And I guess what I wanted to say is that if you fast prior to doing hyperbaric oxygen, that would definitely make it less likely that you would experience oxygen toxicity seizures or CNS oxygen toxicity. So that is clear. I mean, because you're basically giving your body a neuroprotective anti-seizure therapy. And then you're also suppressing insulin, lowering glucose, and elevating ketones while you're blasting the tumors with high pressure oxygen. So you're kind of crippling the tumor's ability to defend itself by reducing the pentose phosphate pathway, which is the cancer's ability to make glutathione. So you're kind of, it needs to do that. It needs like sugar and glutamine to do that. So if you enter into chemotherapy or if you enter into hyperbaric oxygen therapy in that fasted state, that could be beneficial. But I would warn people against doing too much fasting, especially if you are not physically strong and carrying some excess body weight. So even if you're normal body weight, you just have to be careful with doing too much fasting and really appreciate. For me, what I tell patients is let your physical strength be the gauge. Like if you could do a certain amount of push-ups, if you go to the gym, if you could lift a certain amount of weight, and your strength is more important than muscle when it comes to outcomes, but I mean, the both are important. So you should be able to maintain a certain level of strength throughout your protocol. With metabolic based therapies, typically the patient comes out the other end in better health. And that can't be said for the standard of care therapy. They come out kind of, pretty awful shape sometimes. But what metabolic therapies and things like fasting can do is mitigate a lot of the damage that standard care therapies can do.
I'm glad you brought up that piece of fasting with chemotherapy. That's what I was getting at way earlier in the conversation. I was trying to highlight that piece where it can help with chemotherapy being more effective and helping with symptoms during that treatment
Yep.
phase. I'm glad you went into hyperbaric oxygen. I wanted to get into that for sure. So, for somebody that wants that to be more effective, you mentioned the fact that fasting or keto diet is going to be helpful. If somebody wants to bring on hyperbaric oxygen as an adjunct to metabolic therapy, and again, they're either fasted or they're on a keto diet, how often would be the sweet spot of doing that? Like a certain number of times per week? There's a lot of variance there.
Yeah.
Is it just one time is enough, or what? How can you do it too much?
Very good question. We do not have the data for me to even speculate on that. What we do have data on is there's 14 different FDA approved applications for hyperbaric oxygen therapy. And one of them is radiation necrosis. So if you are a patient and you've had radiation therapy, your insurance will cover hyperbaric oxygen therapy. So this is like I've communicated with many patients who have done this. And I was going to the hyperbaric the Association for Hyperbaric Medicine and also the undersea UHMS hyperbaric medicine society, where different clinicians would be presenting on this, even when I was like a graduate student and I didn't have any interest in cancer, but I was like, wow, that's really, they would show like radiation necrosis and this patient had terminal cancer, and like, by the way, the patient's still living. And it's like, whoa, that's that. So it was like a seed was planted in my mind. It was like, oh, was it so they got radiation therapy and they got the standard of care and survival's like 5 or 10%, and they just happen to be an outlier, and that's interesting. And I saw this kind of over and over. So the seed got planted that hyperbaric oxygen therapy could be beneficial. And, work done in our lab, and this is sort of validated by not too many people, because not too many people have hyperbaric chambers with like microscopes inside them, or different electrophysiology, patch clamp, things like that. And even a scanning laser confocal where you can optically section the mitochondria and look at it. But it was very clear that oxygen had a far different effect on cancer cells than it did on healthy normal cells. And it was someone at the Moffitt Cancer Institute that reached out to me and said, I want to talk to you about the hyperbaric oxygen. And his background was hyperbaric oxygen and from the context of hypoxia, tumor hypoxia, but also brought to my attention that the efficacy of radiation therapy was proportional to the PO2 of the tumor, meaning that as a tumor grows, it becomes hypoxic. And if you direct radiation to the tumor, it's very difficult to kill that tumor because the radiation needs to basically strip off the electrons and generate reactive oxygen species to kill a tumor. So many people think that radiation damages cells by creating double-stranded nicks in the DNA, and that creates, mutations and kills the cell. And that does happen, but directly, but the 80% of the ability of radiation to kill cancer cells is through the generation of reactive oxygen species. It's not directly by like the radiation beams itself. It's by the radiation induced increase in reactive oxygen species. And that does not happen if the tumor is hypoxic. So if you reverse tumor hypoxia and oxygenate the tumor and then apply radiation, then radiation becomes like super effective, right? So this is an idea that I had, and it just hasn't been implemented. It's very logistically difficult to do that. But one thing patients can do is, if they have a hyperbaric chamber nearby, is get hyperbaric oxygen therapy, and oxygen stays partially elevated in the tumor even when you get out. And we also know that the reactive oxygen species that are generated from the hyperbaric oxygen stays elevated for hours, if not like a day or more after, right? So if you were to couple that, either have chemo or radiation before or after hyperbaric oxygen therapy, or just do it on the same day, I think that would be beneficial. And yeah, and if you're getting radiation, right, it's going to really help the radiation necrosis. That's like clear, that's an FDA approved application. But you may be able to augment the therapy by coupling the two together. Of course, you could further enhance it by, in a fasted state, if you go into that therapy, both of those approaches with a GKI of 1 to 3, then you're really giving yourself a benefit for a better outcome.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
These are really important things that an oncologist is never going to tell the patient to do. Hyperglycemia and hyperinsulinemia is associated with much greater, sometimes